The Nigeria Center for Disease Control reported 626 new cases of coronavirus from 20 states overnight, taking the country's total number of cases to 27,110. Lagos recorded the highest number of cases with 193 new infections, followed by the FCT with 85 new cases. Oyo recorded 41 cases, Edo 39, Kwara 34, Abia 31, Ogun 29, Ondo 28, Rivers 26, Osun 2, Akwa Ibom and Delta State recorded 18 cases each. Now Enugu 15, Kaduna 13, Plateau 3, Borno 8, Bauchi 7, Adamawa 5, Gombe 4, Sokoto 1. And so far, 10,801 people have recovered and been discharged, while 616 people have died from COVID-19 related complications. On Wednesday night, Nigeria reported 790 new cases of coronavirus from 21 states, the highest single-day confirmation of infections since the outbreak began in the country. Now, this health officials say is due to the fast community spread of COVID-19. Now, the federal government is urging individuals to take responsibility for their health and abide by all safety protocols, as the number of infections could overwhelm the country's health system. Joining me now via Skype to discuss this is Olajumoke Ojeleye, lecturer, Lagos State University College of Medicine and lead facilitator, Research Resources Hub. And also joining me is Julie Mobu, Executive Director, Royal Nursing Consult. It's nice to see you both on the program this morning.
It's nice to see you.
Great. Now, let me start with you, Olajumoke. The issue of the rising numbers of COVID-19 cases has been attributed to the ability to test more people. But the point is, we are still talking about the issue of the system, the health system being overwhelmed. How do we balance this? How do we explain, especially when government is easing out all the restrictions? Aviation is supposed to resume by next week. How do we reconcile this? Can you talk to us about this?
All right, good morning. Thank you for having me on this interview this morning. Thank you very much. All right, concerning what was discussed, it is not a good, it's not good enough that the government is easing restrictions, health systems are overwhelmed. The behavior we are expecting from the populace, at the community level and all through right up is not, we're not getting that yet. So it is much of a concern to us, whether for government, for health workers, for the populace. The truth is people are still scared. So it's worrisome. That's it. It's worrisome. So people just are snapping out of it like, well, we just move on. We move on. However, we still keep losing people. Fine, we get to hear of all the big names, all the big people dying, all the popular people. How about the poor man on the street? How about the people we don't get to hear about? So it is a worry, it is a concern that the government is beginning to ease all restrictions completely. Gaps have not been filled in terms of the health, strengthening the health system. And we still have our numbers increasing up to the point that people don't even have access to regular testing.
All right.
Yeah.
Okay. Now, Julie, let me bring you in here. The issue of safety of health workers is of great concern here, because the point there is, without the health workers, certainly you won't be calling in engineers to come and care for the people or call on accountants. It has to be medical personnel who are trained in this area. But we have a lot of them have died. Some of them have infections and inadequate protective gear for them to attend to people. Talk to us about how difficult and how challenging it is from that window to cope at this particular time.
Well, with what is happening currently, Mike, I think that at this point that the government needs to show more concern. They need to let us know they are more concerned about what is currently happening. Why do I have to say so? It's not just about updating the NCDC website. It's not just about tweeting. We need to see evidential moves as to manage. We want to see news about we have ensured or we are working towards getting more health workers on the roster to see how they can manage these cases. We have trained this number of health workers. We have identified this gap here, and these are the steps that we are taking to cover up these lacunas. It's important for the government to give us this information because I happen to be on many healthcare platforms where we have healthcare workers, and I am not sure, to the best of my knowledge, there hasn't been a call to nurses, to doctors to say, we need more people. We need you to come in for these kind of trainings. What other way do we think that I'm saying this to the best of my knowledge? And I am on platforms where we have nursing leaders, we have, I have access to some medical personnel as well. There hasn't been that move. So if we are easing restrictions, what is, we know what happened when we had this nationwide lockdown. We know the vices that cropped up. So if there are plans and considerations to ease restrictions and they are being eased off, what are the alternate plans to ensure that we don't have more problems on our hands? It's going to be really challenging because more health workers are being affected, and then there doesn't seem to be a plan to cover up that gap.
All right, Olajumoke, let me come back to you on this. I wonder what you make of the challenge in people adhering to all these safety protocols, the wearing of face masks, the issue of social distancing and constant hand washing and all of that. A lot of people are not adhering to it, especially even in Lagos, where you have a number of people, the highest number of concentration of people in the country. People, certainly, even with the messages going around, there are some people who say they have information overload, but we don't see a lot of compliance. What do you think is the reason for this?
All right, so yes, you're very correct to say that there's a low level of compliance across board, with those physical distancing, hygiene measures and all of that. But it's only because we have not brought this message in a way that people would, relate with it. So I appreciate what the government is doing, what NCDC is doing, and what, all the relevant bodies are doing. But we need to meet people exactly where they are. We need to agree with.
All right, it seems the network from Olajumoke has gone off, but let me come to you, Julie. Now, some doctors have called on an industrial action because of lack of care, lack of concern from the government, like you said. Now, some of the states, from what reports we're getting, are cutting down on their budgets generally. Now, talk to us from the window of ensuring that there's a deliberate, really deliberate effort in allocating budget and monies to the health sector. What do you think it should be like?
We have seen there's a standard percentage that has to be allocated to healthcare. That to my knowledge has not been implemented. We haven't been working based on recommendations. Certain allocations that are supposed to be made available to the healthcare sector and to strengthen the healthcare system. I do not think that we need a soothsayer to tell us that there's a need to gather and channel all resources towards strengthening our healthcare systems across level, especially the primary healthcare system. There was a plan to establish some healthcare systems, but what is happening with that? That is why I keep saying that I'm not seeing the mobilization. I'm not seeing the call. So we have nurses who are willing. We have medical professionals who are willing to get onto the field to work. But is there a call? What are the chances that when they get there or they put down their names, they are going to be enlisted, they're going to be enrolled? So there has to be a deliberate effort. And how will this happen? We need to see the mobilization of healthcare workers. We need to see that the measures are being put in place to ensure their security and their safety. We need to see that trainings are being done. There has to be monies channeled into this. How about the remote areas? Up until now, people think that it is a big man's disease, especially as the media is portraying and announcing to us the big shots that are being affected by this infection. So they think it's a big man's disease. I still heard yesterday. So there's a need. When the people behave in a certain way, the government should take it as a feedback. If they do not have the resources to manage the challenges that are coming up, then they should call on. That's why it's called collaborative effort. If we look at the 17th goal of the Sustainable Development Goals, it talks about partnership and collaborations. We are yet to see that. They have been doing it at some level, but we can't keep doing the same thing and expect a different result. Right. This is the time to change the game. This is the time to call in all people, break down those walls, whatever is not helping us achieve our goals. Because over how many million people in Nigeria and how many tests has been done? How many tests have we done? So this should point to us that are we really doing what we are supposed to do?
So it means we're still not doing much yet as of now. All right. Thank you. Okay. Thank you, Julie. Right. Olajumake, let me start with you on this. There are concerns from some of the reports and some of the comments that we're hearing from people on the issue of the use of face masks, especially for those who have respiratory challenges and people who could be asthmatic and all of that. And it is said that face masks usage would not be good for people like that. Can you educate us in that regard?
All right, thank you for having me back. Good morning. Yes, thank you for having me back. Regarding the use of face masks, people with respiratory challenges should still use the face mask. It is very important for their personal protection. One message everybody needs to understand at this time is that you should take personal responsibility for your safety. You already know that you are higher risk as somebody who has a respiratory challenge. So the issue of using a face mask, if you have to go out, if you have to be in a public place, you have to use a face mask. So that means that if you have such condition, you have to reduce your exposure. That's just it. But that you would not protect yourself or you find it difficult to use. I think the face mask is actually difficult for a lot of people to use, and that's why the compliance is low, especially because people don't know how much this protects them. You do not know the status of the person beside you. You don't know anything. So, but if you have to increase your, safety, you have to do it.
Okay, we're having challenges with that connectivity there, or Olajumoke or Jeleye. All right, Julie, let me come to you on this. Still on the issue of the use of face masks. Now, the point there is we see a lot of people who just hang the face mask around their chin that way, and then they're having it there just because in case they run into a security agent or anyone, a law enforcement person, so they can say, well, I have my face mask on, not because they're using it for their protection. Now, do you think that maybe security agencies should be activated in that regard to ensure that people use face masks and use them correctly?
Thank you very much, Mike. Sadly, we have come to a point where we do not regard or think as important personal governance. That is where we have a huge challenge. What is our health-seeking behavior? So our behavior towards our own personal health is questionable. Sadly, this has been ongoing. Let's begin with the use of the seatbelt. How successful are we with the use of getting people to comply with using the seatbelt? It took lots of information and sensitization to get people to use it without being forced to do so. So if they had a problem using and complying with the rules of driving safely, how do we expect them to abide with this or to comply?
All right.
So it's an issue of self-governance. We need to still keep informing the people how important it is for them to protect themselves. And even if they won't, be your brother's keeper. The other person may not have as strong immune system as you, maybe having some underlying medical condition. So for the sake of your neighbor, just wear your face mask.
Okay.
I think the narrative should be here.
All right, I understand Olajumoke is back now. It's good to have your line restored. Now, Jumoke, let me come to you on this. Now, the point there is the government is opening the airports soon, on the 8th of July, and that'll be sometime next week or so, yeah. And we expect that activities in that regard that has been down all the while is going to pick up now. What safety measures should be put in place apart from what the government is doing by ensuring that there are marks on the floor where people should stand, and to ensure adequate physical distancing? How about the people themselves? What kind of precautions should they be taking now?
All right. So we would have to keep saying this. So Julie just raised a very important point, which is now government. How well can people lead themselves? How well can people abide and comply with things that are important in their own life and the people around them? So now we have our airports opening up, no doubt about it. We're going to, in fact, the airports are already, running skeletal services already, and people have to get on board. All right. So what people need to do is, apart from what the government has done, they need to continue the personal hygiene. I expect people who are traveling to have their hand sanitizer with them, to have their face mask even on board. So these are very simple things. You see, they are simple, but they are easily negligible. They are simple, they are easily negligible. Another thing the government can do is to come with bespoke messages to meet people exactly where they are. That was what I was saying the other time. So the elderly needs to understand how he or she should protect himself or herself from the COVID-19. I mean, what is the peculiarity for an elderly person? What is the peculiarity for a pregnant woman? What is the peculiarity? I understand some schools will be resuming very soon. I mean, I think the examination classes, junior, GS3 or SS3, so they are going to resume. What is going to happen when people are locked down? Our kids are locked down at home, and we have the cases the way we have them. What happens when they begin to gather in schools again, or when they begin to take all these national exams? So the messages need to be bespoke enough, and we need to review our strategy. Something must work. Maybe we need to use the language. Maybe we need to use the locality or something. Something must work. And I appreciate that the NCDC and the government are doing quite a lot to roll out these messages. But I think there's still a lot to be done to ensure that people understand the simple message that you need to take personal responsibility for yourself.
All right.
You have to be in place.
Okay, so we have to keep talking. That's what it means in the language people will understand. Thank you very much, Olajumoke Ojeleye, for your time on the program. Julie Mobo, I also thank you for your time on the program. I really appreciate both of you.